course, that's item 1. Item 2, are there any declarations of interest, either personal or pecuniary? None. There being none mentioned, then are there any questions, additions, or changes to the agenda from what is presented?
Alana here.
Yes, Alana?
We just received a media release, so I would like to ask a question about that later, if I could.
I cannot understand what Ms. Bishop is saying.
Go ahead again, Alana.
Yes, we just received a media release in regards to expanded assessment testing for COVID. And at some time in the meeting, I would like to ask Mr. Gill a question about that.
Could we put it under the 9.4 coronavirus update that Dr. DeMille is leading?
That would be fine. Thank you very much, Jason.
Sarah, if you could read the motion, please, and the agenda as amended to be adopted.
Sure. So resolution 1, that the agenda for the regular Board of Health meeting to be held on April 15, 2020 be approved as amended.
Moved by Ms. Ware-Woda, seconded by Ms. Bishop.
Yes, correct, sorry.
And if you could then record the vote, please.
Sure. So Ms. Bishop?
Yeah.
And Mr. Gale?
Favor.
Thank you. Mr. Hamilton?
In favor.
Ms. Hardy?
Yes.
Thank you. Ms. Parashallow?
In favor.
Thank you. And Mr. McCaffrey?
Yes.
Thank you. And Mr. McPherson?
Favor.
Thank you. Mr. Gorman?
Favor.
Thank you. Ms. Oliver?
In favor.
Thank you.
In favor.
Thank you. Mr. Balance?
In favor.
Thank you. Mr. Resna?
In favor.
Thank you. And Ms. Ware-Woda?
In favor.
Thank you. And the motion is carried.
Thank you, Sarah. Yesterday, we had a question about changing the process for voting. And for recorded vote, we have to either get a yes or a no. So at the moment, the process will be asking everyone for their vote and asking yes or no at the same time. And if we can find another way of doing it that works within the bylaw, we'll distribute that in advance of our next meeting. Thanks, Katie. No, I'm sorry, my voice I know does not carry, especially if you're trying to pick it up off of the speaker. So there's no information session. So we'll move into item 5, which is the minutes of the health unit meeting from February the 19th. Ms. Stevens, if you could read the motion, please.
Sure. So resolution 2, moved by seconded by Mr. Black, that the minutes of the Thunder Bay District Board of Health regular session meeting held on February 19, 2020 be approved.
And if you could carry the vote, please.
Yeah.
And Mr. Gale?
In favor.
Mr. Hamilton?
In favor.
Ms. Hardy?
Yes.
Thank you. And Ms. Parashallow?
Yeah.
Thank you. Mr. McCaffrey?
Yes.
Thank you. Mr. McPherson?
Favor.
Thank you. Mr. Gorman?
I wasn't present at the stage.
Okay. Thank you. And Ms. Oliver?
Favor.
Mr. Smith? Mr. Smith, are you there? Okay. Mr. Valance? Thank you. Mr. Vesna? Thank you. Ms. Ware-Woda? Thank you, and the motion is carried.
Thank you, Ms. Stevens. We have no matters arising from the minutes.
so through the chair, these are the audited annual financial statements that we did this year. We worked with BDO Dunwoody, our auditor. So we did do a detailed review of the financial statements this morning with the auditors and the executive committee. And I know Mr. McPherson will touch on that after I say a few words. So before, when you're looking at the financial statement, there is a few things that I would like to note. One being that there are differences between how we account for our financials between the audit and so the audited financial statements, you do see a surplus in these, but on a cash basis, which is what we actually report to the ministry, we ran a deficit this year of 122,000. So that is what will be reported to the ministry. Key differences are policy differences on how capital assets are accounted for and accrued vacation pay. So that is the reason for those main differences. The financial statements are largely in line with what has been presented to the board throughout all of the quarterly reports throughout the year. So there are no surprises to any of that information. Mr. McPherson, do you want to comment on the meeting this morning with the auditors?
I was going to let the group, if they have any questions first on what you presented, and then I'll summarize our meeting this morning.
Okay, so if anybody has any questions, I am available to answer those.
There being no questions, then on behalf of the executive committee, I'll summarize our discussion with the auditors this morning. First, materiality, what they had given us is around 528,000 stated that. Just what most important to the group is that there were no unadjusted differences or disclosure omissions identified through the course of the audit from the auditors, which is very, very positive. There's also no management letter to us with any concerns from the auditor. In short, it was a very clean audit. The auditors are very appreciative of all the work of our staff in preparing the information for them during this challenging time. Auditors this time did also have an information system audit, which is something we've not done before, where they took a look at our computer systems and our financial packages. They looked at the controls and access into our technology, access to accounting software, who, how, what the controls are, who the individuals are, what happens if a person comes or goes, was that paper trail there? Is there a paper trail for when a person has an issue with the information systems? All of those were very well done in view of the person doing that audit. The auditor is also very pleased with how the access to our servers, our server rooms, being locked. So this was an additional portion to the audit that we had not had in the past, and it gives us good confidence that our information system and our security is adequate. They spent a lot of time going through our revenues, which is tied to which is largely from grants and from the municipal contributions. So they ensured that the money that we said we received, that we have received, the processes that we use to spend the money are in line with our purchasing processes. They found that all of those processes were correct. Correct sign-offs were used. And in their process, it did not have any disagreements with our management team on how the process and how the audit went. So certainly very encouraging on behalf of the executive committee to have heard that the audit was that clean, as the auditor said. So we're very, very encouraged by the work that our staff are doing, and that the auditors have confirmed for us that we have tremendous systems in place and staff very much confident. Are there any comments from other members of the executive committee on what we heard this morning? There being none, then Ms. Stevens, could you read off resolution 3, please?
Yeah, So resolution 3, moved by Ms. Wariwoda, seconded by Mr. Gale, that with respect to report number 16, 2020, finance, we recommend that financial statements of the Thunder Bay District Health Unit for the year ending December 31st, 2019 be approved as recommended by the Executive Committee.
Record a vote, please.
Okay, so for the vote, Ms. Bishop,
Yes.
Mr. Gale,
In favor with thanks.
thank you. Mr. Hamilton,
In favor?
thank you. Ms. Harding, thank you. Ms. Harris Shallow,
Yes.
thank you. Mr. McEachran,
Yes.
thank you. Mr. McPherson,
In favor?
thank you. Ms. O'Gorman,
In favor.
thank you. Ms. Oliver,
In favor.
thank you. Mr. Smith, thank you. Mr. Valance,
In favor?
thank you. Mr. Vesna,
In favor?
thank you. Ms. Wariwoda,
In favor.
thank you, and the motion is carried.
Thank you very much, Ms. Stevens. Moving on to item 8.2, which is the Shared Library Services Partnership Budget. And Dr. DeMille, you have the floor. Mr. Dill, you have the floor.
Okay, so through the chair, report 2020 relates to 100% funding that we received from Public Health Ontario to run the shared library service. So our health unit serves 7 other health units through this service. Total funding is $123,846, and we require board approval to accept this funding for the year. And the period is April 1st, 2020 to March 31st, 2021.
Questions from the group for Mr. Dill? Ms. Stevens, if you could read the motion, please.
Sure. Resolution 4, moved by Ms. Bishop, seconded by Mr. Gale, that with respect to report number 2019 foundational standards, we recommend approval of up to $123,846.49 and 100% funding from the Ontario Agency for Health Protection and Promotion for the purpose of continuing the Shared Library Services Partnership Hub Library as a Thunder Bay District Health Unit for the period of April 1st, 2020 to March 31st, 2021. And that the Director of Corporate Services and Manager of Finance be authorized to complete any administrative requirements of the submission process as required.
Thank you, Ms. Stevens, if you could record the vote.
Okay, for the vote, Ms. Bishop,
Yes.
thank you. Mr. Gale, thank you. Mr. Hamilton, thank you. Ms. Harding, thank you. Ms. Harris Shallow,
Yes.
thank you. Mr. McEachran, thank you. Mr. McPherson, thank you. Ms. O'Gorman,
In favor.
thank you. Ms. Oliver, thank you. Mr. Smith, thank you. Mr. Valance, thank you. Mr. Vesna, thank you. Ms. Wariwoda,
In favor.
thank you, and the motion is carried.
Thank you very much, Ms. Stevens. Item 8.3, which is a discussion on if this is the time of day that we want to have our meetings and if people can get on and what are the issues with the polls. So, Mr. Dill, continue, please.
Yeah, so through the chair, this is an open discussion about potentially changing the meeting time during this state of emergency due to potential connectivity issues. We know that there are sometimes issues within the district. So we were looking at having this discussion to see if there was interest in moving the meeting to earlier in the morning when there's less traffic. So I open up the floor for any comments on that.
Alana,
Ms. Bishop?
can you hear me then?
I can hear you.
Okay. Then I gather that the only way to do this is audio only, correct?
I'm not audio only, we could do it by a video platform, and administration is looking into that option. Should that not be ready though in time for the next meeting, we wanted to have this discussion because we need to get notice if we're going to change the time of the meeting to.
All right. Okay, I'm glad you're thinking of that. Thank you.
Yeah, John McEachran here. My problem this morning, Jamie, is I was not able to get through. I was three different cell phones trying to get through for the executive meeting, and then every time I tried to just ended the call, let me through. So morning is not very good for me.
You're already getting into for 1 o'clock?
Yeah, 1 o'clock was fine, but this morning I tried for an hour.
Okay, other thoughts from people?
I think it's Don speaking here. I'd like to just tag on a little line I said there. I mean, we've been using Zoom with a couple different organizations that I'm on, and so much nicer to actually have a group there. We've had no issues with it. I know there's been issues in some areas with Zoom. We've had no issues whatsoever through OEPSB and through municipal council, and it is a lot warmer meeting, and it's just better.
Yeah.
So I don't think I mean, I don't know what the issue is with us and Zoom, but I think it might even be worth doing a trial run and just see what happens.
So
Thank you for your thoughts.
through the chair, administration is looking at options for the next meeting to have a more interactive and video capability.
So I'm hearing that we'll leave the time at the 1 o'clock with the desire then to have it via a video. If you can let Ms. Harding know that we're looking at going into a video format.
I believe he isn't able to do that.
The option would still be to dial in along with the video.
Mr. Chair, it's Kristen Oliver, if I could chime in for a second, please. I know if you look at Microsoft Team meetings, you can do both very easily, and I think the security measures are more enhanced Microsoft Teams software over Zoom. Thanks.
Thank you, Ms. Oliver. With the municipality of Greenstone, we are using Microsoft Teams. For the hospital, we're using Zoom. So as far as bandwidth, up here I've been able to work with both. Or with either, I guess. Other people's thoughts on the video format?
Hi, this is Jessica Rochelle. Being out in Dorian, I'm not sure how my internet will hold up to the video conference, but I'm sure going to try either format.
Thank you.
Dave Allen here. I would like to see the video capability too, if possible.
Thank you, sir. So I think, Mr. Dill, you're getting the desire of the group.
Through the chair, yes.
Michelle here.
Yeah, Michelle?
I'm already on Microsoft Teams as well, and probably Norm is as well, so we're already set up.
Okay, no, good. That's good to hear. And it sounds like Ms. Oliver is set up. I know we are. Municipality teams. So if that's an option for us, Mr. Dill.
So through the chair, we will definitely look into that and get back to the board.
Thank you very much, sir. So as far as 8.3, Ms. Stevens, we won't need a motion. We've just provided direction to staff.
Okay, that sounds good. And the consensus is to remain at the 1 p.m. time?
That's correct. And for preferences to have a video format.
Okay.
And for sure, that direction.
Excuse me, Ms. Lennon was trying to say something.
So through the chair, this will be the process through this emergency. At the end of the emergency, the intent would be to revert back to our regular meeting rules.
Yes, the resolution yesterday expires upon the termination of the emergency order. Item 9, Communication for information, first is 9.1, that was legal expenditures. Mr. Gill, summary.
So through the chair, this is report 18/2020, related to our legal expenditures. So for the year, we are over budget, which is expected and previously reported in the quarterly variance reports. This is also consistent with previous years. We have typically been under budgeting our legal fees, and we find savings throughout the operations elsewhere to make up for this. The largest portion of our legal fees relates to labor relations and negotiations, which happened during the year, and an additional 43,000 related to SLIFNet and the complexities around the work that was ongoing throughout the year there.
Questions on 9.1 for Mr. Dill? Next, then 9.2, the procurement practices report.
Thank you. So through the chair, this is report 17/2020, and as per the bylaw, we report our procurement practices on an annual basis. So for this year, you'll see that there are a few less RFPs and tenders. And what we're doing is we're working a lot with the consortium that we are a part of, and we are tapping into the provincial vendor of record system that's available to us through the province of Ontario. This has created significant savings for us over the years, or just this year alone for our renovation projects. By using the vendor of records, we saved approximately 75,000 compared to the RFPs that we have done in the past. So that's why you're seeing less of those, but there will be certain situations where we have to continue to run those processes, but we continue to follow our procurement policy. And this is the report that summarizes everything for the year.
Mr. Dill, if you did take a minute to explain to the group who may not be familiar with provincial vendor of record process and how that we're able to use it.
So through the chair, because we are part of the broader public sector, we are eligible to use this. And what happens in that system is at a provincial level, they run tenders and requests for quotes and proposals and provide us a list of vendors in our area that have already been vetted through a procurement process with the province. So we benefit from the greater exposure that those vendors have provincially, as opposed to us just doing it ourselves.
We certainly have the opportunity to benefit from scale of operations and scale of purchases on provincial level.
Through the chair, that's correct. And in each instance, we do look at locally if there are other vendors that we feel should be included. We may make a different decision and go for, an RFP process depending on price and scenario. So we do take all of that into account each time we look at this.
Thank you, sir. 9.3, our board meeting expenses.
So through the chair, thank you. This is report 19/2020. Again, this is a bylaw requirement of the Board of Health meeting expenses. A list has been provided in attachment 1 to the report. The total this year is $1,648.90. You'll note that that is higher than the previous year. And in the previous year, as a result of the labor disruption, we did not have a Board of Health dinner. And this year we did, and that is the main reason for the difference in expenses.
Questions for Mr. Gill on item 9.3? Thank you, Mr. Gill. To 9.4, which is Dr. DeMille and the update on the coronavirus.
Thank you very much. I'm taking note here. This is a very situation for us to be navigating through, obviously for our communities to be navigating through. In the public health, especially diseases, but for many other things. This and its impact on us. So it has led to our organization and our capacity and needing to move people around to be able to support our broader capacity in responding to this happen very quickly. And things can change very quickly. And sort of the guidance and direction we get from the province, and we need to be able to respond and adapt to those rapidly changing environments. At times, it is quite challenging, quite even overwhelming. Although structure and IMS and the various components of it. Involved in the IMS structure, and we are always the temperature of how we're doing with the organization and how we're doing with our staff as we manage through these very challenging times. We have to say, because two of them are sitting here, we do have a very strong management team. That has been very helpful in navigating through these times. So as I noted, the significant capacity issues in the organization, if I could sort of, because a lot of our programming had to change or even be halted, we were able to bring forward staff from all parts of the organization to support the COVID-19 response, which, while quite challenging, has been quite successful at dealing with some of the issues moving forward. Of course, at the same time, this pandemic affects us as an organization, and of course, it affects our staff. And so we do have to be very mindful of that and take the appropriate measures to protect our staff and their health and well-being at these times. So, what I am going to do is actually I'm going to go through the IMS structure in order to give you some ideas of the various things we are doing under each pillar. And some issues that we're maybe facing. I will come back. I won't go through it exactly the way the IMS structure is laid out. I'm going to have Ms. Roberts speak to the logistics, which is about the mobilization of our staff. And Mr. Dill could speak to some of the finances and admin aspects of this as I move through it. So I am the incident commander for IMS structure, and under that I have there's four main pillars of the IMS, which is operations, planning, logistics, and finance and admin. So and then there's a few other functions as well that I'll get into after. So operations is a very big aspect of our work. The lead for operations is Tennille Rabichuk, who's the Director of Health Protection. This is really certainly all of health protection, as well as the staff from health promotion, are very much involved in this COVID-19 response. So some of the things that are done under operations is what we call case and contact management. This is stuff that we do all the time with respect to infectious diseases, and we continue to do it now with respect to COVID-19. So we do follow up on all positive confirmed cases of COVID-19 in the Thunder Bay District Health Unit area. We follow up with the individuals, and we work with them to determine who might have been exposed while they were in their infectious period. We do provide advice and guidance to those individuals with COVID-19, as well as people who might have been exposed. And we continue working and connecting with the individuals with COVID-19 throughout the course of their illness, and even can advise them when their illness is fully resolved according to criteria we are provided with. Certainly, if somebody who has COVID-19, we monitor their overall health and can refer them to, can support them in getting further assessment if they need it. And we do find that happens. With respect to individuals who are considered contacts or those who might have been exposed, we do provide them advice and guidance that could include anything from self-monitoring to self-isolation.
And if while they're, for example, self-isolating, they develop symptoms, we can refer them for assessment and testing, and we do follow up with them throughout their course. As part of CASA, so that's a, sorry.
I'd like to remind everyone to please be on mute, so we do get other phone calls that doesn't come through. Please, go ahead.
So aside from case and contact management, there is testing. We do support broader testing in the community. We do work closely with the assessment centers. So there is one at the Thunder Bay Regional Health Sciences Center and several in the district communities. For the Thunder Bay Regional one, we do refer to them, so that we get appointment slots every day that we will fill with individuals who need assessment and testing according to the criteria that they've laid out in their medical directive. We also do work with the ones in the district. We also have a separate relationship with the community paramedicine program at Superior North EMS, who can actually go to different places, including individuals' homes, and do the testing and assessment in those locations. As you may have heard, there's been challenges overall, provincially and even nationally, around testing, in terms of testing supply, like testing capacity, in terms of the swabs available, and also broader the ability to analyze tests. And so we've had to navigate the challenges related to those testing challenges. We do have a call center that runs in extended hours every working day, as well as I think from 9 to 5 on the weekend, on both days on the weekend, and certainly throughout the long weekend we just experienced. We had staff on the call center every day. So these they take a number of calls, including from, for example, individuals who might be self-isolating to develop symptoms, other individuals in the community, various different partners and organizations who might call us, enforcement-related issues and such. So our call center has a wide variety of staff trained to be able to answer and respond to various types of calls, and refer where needed to experts in our organization in particular areas. Another big area under operations is long-term care home and retirement homes. It's very clearly, especially right now, a very a priority area for the provincial government, who is continually updating directives and guidance from the ministry in order to support a strong response to any cases in long-term care home or retirement home residents and staff. And so we are certainly positioning ourselves and increasing our own capacity to very quickly respond to an issue in that area, and doing quite a bit of advanced work with long-term care homes and retirement homes. Some of the other areas that fall under operations, daycares and schools. For example, we were working with the DSAB around the provision of essential licensed daycares for essential service workers. We have a working group. We're involved with a community partnership for vulnerable populations, specifically the homeless population within the city of Thunder Bay, and basically setting up alternative shelters and isolation facilities should there be cases of COVID-19 in that particular population, and we work with a number of different partners around that. We do the enforcement of many provincial orders. So under the Emergency Act, all the closures, for example, or the limitations on gathering, we do have that complaints line and do receive complaints and do follow up on those. There's other work, for example, around food distribution and food security that we do just to make sure that the food distribution processes are done in a safe way. So that's an example of stuff. I'll note, as you all likely heard, what essentially is an outbreak onto our Lac des Îles mine that happened, that we were quite intensively involved with in the last few days, and really continue to be involved in at a very significant level, just because of the number of workers and the potential a further spread within that population. So that's one thing that, of course, is not, that was unexpected when we got that first case just a little over a week ago, but had to mount a fairly significant response in dealing with that. I'm going to move over to the next pillar, which is planning. And this is really what I would call the epidemiology area. So we have Lee Saswirda, who is the manager of environmental health, but he's also an epidemiologist. And we have 2 epidemiologists and some people for data management working under this pillar. So this is really the surveillance piece. It's monitoring and gathering all the data on our case and contact situation, managing outbreak, like the sort of lab reveal information that we get, and preparing to respond to other types of outbreaks like it should occur in the long-term care sector. Logistics, I'm going to come back to because I'll pass it on. Some related functions in the IMS include a safety officer who is focused on any some of the effectively social distancing are some examples of. I'll just move on to the broader area. This next. The messaging, which often changes very frequently as direction changes. We try to maintain up-to-date information on the website. Updating. Coming from other centers, other organizations, just appropriately with the right guidance. They also develop various community products highlight some of the videos, for example, that are to help promote social distancing and various other things that people can do. And I think it's quite a hit, actually. Judging by the interactions people have. It also works with me and releases and our trying to be the first transparent cases. You know, I'm a spokesperson for the media, so certainly trying to effectively briefly touch on some of the that's on under. So we have very strong healthcare. Support long-term care around, for example, vulnerable populations. Connecting in the district. And we also obviously under the healthcare banner with long-term care. All of our connection to municipalities. So I attend the municipal emergency control group of the Thunder Bay. Update on our key at that table. We also have a separate connection once a week with the district. Those districts. Just to be these and townships outside of this, you know, yeah, in the surrounding areas. So, in a couple of meetings, regularly with the public health physicians, the First Nations and Inuit Health Branch, as we respond to cases that cross both jurisdictions. I also attend twice, along with like Linda Roberts, for example, twice weekly tables with the Sioux Lookout First Nations Health Authority. And just the work that they're doing, that has also implications. Strong provincial operation, public health. We might hear Ontario. About work and priorities. To hear from. I also regularly connect with my colleagues and medical officers of health. Definitely some other specific issues. Health group or health nor so that's so what I that's my so that's what I was pass it on to Linda Roberts and then to provide any additional comments in their area.
Thank you, Dr. DeMille. So, Ms. Roberts?
Okay, can everybody hear me okay? I'll just give you a more detail from a logistics standpoint. Shifting, I can say, the majority of our staff over to COVID required a number of changes to our regular programming, so much of our regular programming has been suspended. However, there's a number of programs, probably a dozen areas where we have continued to offer some sort of service delivery. Things like needle exchange, street nursing, HPHC, tobacco cessation. We're doing those in often in an alternate format, either only or phone service, in order to continue to support people that we absolutely need to support through this time. That has changed over the little while, but we're trying to support people where we can and service that's going to create further problems down the line. Like I said, we shifted most of our staff to COVID, and some of that has required in their new roles, so we've issues, training supports for people. We've made a number of organizational adjustments internally. Dr. DeMille talked about the call center. We're not set up as a call center. That's not how we operate. So it required a number of changes in order to switch to a call center setup. We receive up to 1,500 calls a day, and on some days required some equipment changes and that sort of thing. We switched to a 7-day operation with extended hours. We brought on a few additional staff, and then we've done a number of things internally to support occupational health and safety for staff well. So screening of staff and visitors, limiting access to the building, things like additional cleaning, physical distancing of staff, moving of staff within the building, having Skype meetings and that sort of thing instead of meeting in person. And we have many staff working from home right now. In moving forward, we're hoping to get more and more staff off-site. It's somewhat complicated because of equipment and the type of databases and things that we need for some people doing contact tracing, for instance, or call center work. But we're working on that. Certainly, there are all sorts of challenges with supply chain at the moment. So whether it's computer or phone equipment or PPE, all of it is challenging. So there's procurement issues that we're dealing with, but so far we're managing as best we can. We have also expanded an EMR that we use for Kinji internally to be used far more broadly. So that's sort of changes to incorporate the functions. So we moved on a lot of those internally in order to support being minimal and responsive to emerging needs, but also in keeping our staff well. And we want to keep people going off ill, so we're trying our best to make sure they're working in the same way possible. So I think that's it for me. I'll pass it over to Mr. Dillon.
So from a finance and administration perspective, as Linda noted, a lot of our purchasing needs have definitely changed. So we're working with 4 different vendors. A lot of our are not, we're not necessarily. We have received some flexibility from the industry and from other ministries within our HVAC funding, that they recognize that this is a serious event and we need all hands on deck. I will note that we are separately recording all of these expenses, but moving to a 7-day operation and all of the pressures that have come with COVID-19, there is a cost associated with that. So we are tracking those accordingly. We're managing them the best way that we can given the situation. And as it develops, we'll continue to keep the board up to date through our quarterly report.
So thank you, everyone. So we have Mr. Dillon, Dr. Mill, and Ms. Roberts. So from the directors on the board, on the governance-related questions, I'm sure we can ask a number of technical questions. We can allow our staff to deal with them. So for those who have questions, this started.
Well, I don't know if it's a governance question, but I guess in regards to something we just received from the health unit. Can I talk to this a bit? It's in regards to testing.
Let's start with the question.
Excuse me.
Right. I'm very pleased with the parents and criteria for testing for COVID-19. But I think you all realize we don't know about this virus that we do know. Now, what is glaring to me on this page is the word symptomatic. It occurs 10 times, and it's symptomatic healthcare workers, symptomatic residents. I feel that Doug Ford was on talking about the importance of long-term care homes, long-term care homes, about the health people front line. And it's all here symptomatic. My personal opinion, I just want to put it out there, I think you have to establish a baseline, especially with long-term care and with healthcare workers. Why? Because we don't know if you're spreading it and you're not symptomatic. So if you have a baseline for healthcare workers and the patients, then a lot of workplaces each day are giving their staff a checklist of 6 things. You feel sick, you have a sore throat, etc. I think in only this way will we ever really be able to relax restrictions for the public. This is a global problem. In our testing, if we can get the proper angular mediums and the team right here at the hospital next week, it'll be a 4-hour test. So that's just my take on testing, and I think something should not be systematic. It should be done to establish. I don't know how many people feel about that or anybody else, but.
I appreciate the comments, Ms. Bishop. Does Dr. Mill wish to
Yes, I would very much like to comment because I think that there are significant challenges with asymptomatic. Have no symptoms. The result the virus. Somebody could actually I think that I think that. Testing. COVID-19 in there. So I just thought, are in the latest. Also, self-isolated for, also isolated for results show as it's recognized.
I appreciate that answer. It's a very good answer, and thank you for that.
Thank you. Other questions for Dr. Hill, Mr. Hill, or Ms. Roberts on their report on the Our next meeting is Wednesday, the 20th of May at 1 o'clock, where we will do our best to have my video. Before we adjourn, I'd like to take a minute just to thank Dr. Hill and all your staff for the work that the crew is doing. It's tough, it's long, it's hard, and from the Board of Health, please, our thank you to you and to your team. Thank you. Ms. Stevens, the number 11 adjournment, please.
Resolution 6, moved by Mr. Ballas and seconded by Mr. Bishop. Meeting held
And the vote?
and
Yes, thank you.
thank you, Mr. Gale.
Everybody else better vote yes.
Okay. Hamilton.
Yes.
And Ms. Hardy? Okay, thank you. And Ms. Harris Shallow? Thank you, Mr. McCaffrey.
Yes.
Thank you, Mr. McPherson.
In favor.
Thank you, Ms. O'Gorman.
Yes.
Thank you, Ms. Oliver.
Yes, thanks, everyone.
Thank you, Mr. Smith.
Yes, thank you, everybody. Stay safe.
Okay, thank you, Mr. Rollins.
Yes, thank you.
Thank you, Mr. Bethel.
Yes.
Okay, thank you, and Ms. Merriweather.
Yes, and much gratitude to Mr. Neal and all of you over there.
Thank you, thank you. And the motion is carried.
Thank you very much, everyone, and stay safe, and we'll speak in a month.
Thanks so much. Thank you. Bye.
Bye, everyone.